Like most of the rest of the country, flu has hit Oklahoma fast, furious, and earlier than usual. 100 people were hospitalized in just the past week. Several school districts have shut down because of high absentee rates among children and teachers. Vaccine supplies are running low in some areas, and it's believed it will be several more weeks before the number of flu cases subsides.
Okay, ready? Here we go. Big breath through your mouth, blow it out. You're all done. Look at that big girl.
I told you it was quick.
Awesome.
5-year-old Abby Lester finally got her flu shot at the Tulsa Health Department this week. Her pediatrician ran out of the vaccine, so Abby's grandmother, Jean Berger, tried several pharmacies before coming here.
So the other two sisters got their flu shot, but everywhere I've been, you have to be 7 or 9 to get it. So we came out here today.
Danielle McDonald also came to the health department to get a shot for herself and, more importantly, for her 7-month-old daughter.
It's horrible, and they're all small babies that I've been hearing of getting it. On my Facebook, it seems like everybody has it.
In the last 2 weeks, we've seen a huge increase in the amount of clients coming into our clinics to get the flu vaccine. I think at one point last week, in a 9-day span, we had given over 500 flu vaccines. So we're definitely starting to see a huge increase in those that want to be protected against the flu.
The Visiting Nurses Association has given out 14,000 doses and had to reorder twice. They may have to order more.
Probably half of the people coming in now have either called before they got here to make sure that we have it, or they say they've been to another facility and couldn't obtain it.
The Oklahoma State Department of Health reports the number of flu cases is still increasing. Between January 9th and 15th, there were 100 new reported hospitalizations related to the flu. The week before, there were 92. Since September 30th, 484 people suffering from the flu and related complications have been hospitalized. Tulsa County has been hit much harder than other parts of the state. By January 17th, 3 people had died there, 162 had been hospitalized. Erin Sharp is one of those.
I went to the hospital because after 3 days of 102 temperature, I wasn't able to keep any water down, and I was getting pretty dehydrated at that point.
After receiving fluid, she was able to return home. Erin can't remember being so sick.
It was anything that could feel bad felt bad. My hair felt bad, my eyelashes felt bad, everything hurt and was just very uncomfortable, would be the best way to put it. Just uncomfortable in your own skin even. Just laying down hurts, sitting up hurts.
EMSA ambulance calls are up 20% in Tulsa and 10% in Oklahoma City due to the number of suspected flu cases.
It is a very busy system. It is increasing our call loads. We've got record numbers of calls than we've ever had. So we're being hyper vigilant to keep our own folks well, and they're not immune to the flu either.
Hospital emergency room workers have also fallen victim to the flu.
A lot of the staff actually has been ill or having influenza-like illnesses. So there are a lot of viruses going around that are mimicking the flu now. So even if you get the flu vaccine, you may get something else that's less severe than the actual flu. So they've been out, so we've been having to use the staffing office to try to fill some of their shifts as well.
Dr. Jennifer Amon says the flu symptoms are more severe than last year, and those hit hardest are missing a lot of work.
Most cases of the flu this year are usually resolving within a week, but those cases who are having secondary problems with the vomiting or with the respiratory difficulties are definitely lasting longer. So depending on the severity of illness, they may be out a couple of weeks.
At Tulsa's Rusty Crane restaurant, they're being hyper vigilant about hand washing and sanitizing.
Well, it's interesting that you're choosing to come today because we actually have 2 employees out today with the flu, and then we had 2 last week who were out for 4 or 5 days.
Waitress Jamie Farrell is better now, but she was down with the flu for about a week.
I had a headache and I was very, very tired, fatigued and worn out. I mean, just getting up to get a glass of water really wore me out.
Did you get a flu shot?
No.
Will you next year?
Probably not.
Why?
I just don't like those extra shots and those extra chemicals in my body.
Did you get a flu shot?
I did not.
Why not?
I don't ever get sick.
Health professionals say anyone can be susceptible, and the more people who become sick, the farther the flu spreads. Those with weakened immune systems, like young children and the elderly, are more at risk for getting the flu and having complications. Everett and Gail Flanagan are homebodies and thought they wouldn't be exposed to the flu virus. But when children came to their church sick, the Flanagans decided they better get vaccinated.
We both have cardio-asthma type of disease, and we were afraid that if we get it, it's going to be a whole lot worse on people with heart problems than it is. I mean, it's hard on everybody, but it could be a lot worse, we were told.
Women who are pregnant are on the priority list to get vaccinated because their immune systems are also compromised. Children under the age of 6 months can't receive the flu shot.
If you're in a home with young infants who are too young to be vaccinated against the flu, it's important that you get your vaccine to not only protect yourself, but also to protect them.
It takes 2 weeks for a vaccinated person to build up full immunity.
It's very rare, but there are a few cases that are coming through that still get the flu, and either that's because their body didn't build a strong immunity or they were exposed to the flu in that 2-week period usually. But they usually don't get as sick as those folks who didn't get the vaccine.
If you get the flu, a doctor's prescription could help ease your pain.
The first 2 days is very important. So when you start to feel like coming on, go to your doctor. Go to an urgent care facility. And that way you can take the best advantage of the antiviral drugs. There are antiviral drugs that will help alleviate this.
If someone can't get the antiviral medication and symptoms are severe, healthcare workers say call an ambulance or have someone take you to the nearest emergency room.
If you're sick enough that you can't keep fluids down, that you're getting dehydrated, you definitely need to come in and be evaluated. Or if you're having other symptoms like difficulty breathing, difficulty walking to the restroom because you're having so much trouble getting around, those kinds of things would indicate that you need to come to the emergency department.
It's not too late to get a flu shot. CDC says that we probably have another 4 to 6 weeks of hard, heavy flu here.
Because of the high demand for flu shots, it's best to call around to see where vaccines are still available. Pharmacies could be out one day and receive another shipment the next.